Okay, so for today lecture, we talk about the muscle of mastications. It's very important for you. You as a dentist must know some information about the muscle of mastications because they are related to the movement of the mandible. So first, we started by some introductions. The mastication or chewing process, the process by which the food is crushed and ground by teeth. It is the first step of digestion, and it increases the surface area of the food to allow more efficient breakdown by enzymes. And food after swallowing is called the bolus. So, for the introduction, we must know first about the process. What is the process of mastications? What is the process of the chewing? The mastications, when we say mastications, it means when we eat the food, this food, it must be break down to a small part, and this small part must be uh, um, it's uh, with the saliva, it converted to the bolus. Okay, so the dryness of the food is disappeared by the action of the saliva. This is the first step of digestion. The first step of digestion. And another step, they occur in the stomach and other part of the body. So the first step of the chewing and digestion, it's the first step, it's occur in the oral cavity by the action of some organ, some uh, part of the body. One of the part is the mandible, another part is the muscle of mastications, another part that ruled the first step of digestion and mastications is the role of the saliva that's secreted by the salivary glands. So the mastications is the process by which the food is crushed and ground or grinding by teeth. The first step of digestion increase the surface area of the food to allow more efficient breakdown by enzymes. When the food is break down to the small part and it mixes with the salivary glands, saliva, with the saliva that's secreted by the salivary glands, this saliva contains the enzymes that mix it with this small particle, this grinding small particle of the food, and it's converted to the bolus. So, muscle of mastications, the muscle that move the mandible, another name of the mandible, is called lower jaw, are also known as a masticatory muscles because they are involved in biting and chewing process. Chewing process in the during the chewing process or during the mastications, the tongue manipulates food and teeth grind it. So why we call the muscle of mastications? Because they are contribute to the process of mastications and they are attached to the lower jaw or they are attached to the mandible to involve the first step of the digestion, okay, which is the grinding of food by teeth and they convert it to this small part, and this small part are mixed with the saliva The saliva contain enzyme, and this enzyme lead to formation of the bolus. And later the next step of digestion becomes started. So the first step are um, started in the oral cavity. The muscle of the mastications, we have the common characteristic because they have the same characteristic. All they are same. In all are inserted to the mandible. All of them, we have the muscle of mastication. All of them, they inserted the insertion point. It's the mandible. As you know, any muscle, they have origin part and they have insertion part. So any muscle in the body, they have the origin part, skeletal muscle I talk about. Any skeletal muscle, they have the origin part and they have the insertion part. These muscle of mastications, they are originated from many parts, okay, different part of the skull, while all of them all of them inserted to the mandible. What do you mean by that? What do you mean by that when we called this muscle inserted to this area? When we called this muscle the insertion point is this area, it means it's the active part. The active part. The origin part is not active for the muscle, while the insertion point is the point that the muscle do its functions. So all the muscle of mastication they insert to the mandible. It means the action point, the function of this muscle, it related to the activity of the mandible. The second point, all are innervated by the mandibular division of trigeminal nerve. Because all of the muscle of mastication are developed from the same origin, from develop in the embryo, they develop from the same origin. They all of them have the same innervations, the same innervation. As you know, we have the mandibular, we have the trigeminal fifth cranial nerve. This trigeminal nerve have three divisions: ophthalmic, maxilla, and mandible. The ophthalmic is pure sensory, the maxilla is pure sensory, while the mandibular division of trigeminal nerve is both sensory and motor. The motor part of this mandibular division, when we say motor supply, it means related to the movement of the muscle. So the mandibular division of trigeminal nerve are responsible for the movement, for the motor supply of the muscle of mastications. The third point, all are concerned on biting and chewing. All these muscle of mastication, they contribute in the process of the chewing. Function to move the mandible, it means all of them contribute to movement of the mandible. To secure, then stabilize the mandibular positions. They contribute to the stabilization, and also where is the position of the mandible. And the third one, to determine the direction of mandibular movement. Okay, so we have, according to the function, functionally, the muscle of mastication are classified as jaw elevators and jaw depressor. Either they are lead to pushing the mandible upward or pushing the mandible downward, okay, or side by side, and the jaw elevator that lead to upwarding the jaw. Keep in your mind what is muscle. We have the masseter, temporalis, and medial trigoid, while the jaw depressor is lateral trigoid, anterior digastric and geniohyoid muscle, and mylohyoid. Now we talk about the important point of our lectures, our practical lectures, which is the primary muscles of mastications. We have the primary muscle of mastications. The first one is temporalis, the masseters, lateral trigoid, and medial trigoid muscle. Now we talk about each of these muscles one by one, okay? This picture, so this picture show each muscle, temporalis, lateral trigoid, medial trigoid. Medial, it's on inside of the mandible. Lateral trigoid, medial trigoid, and masseter muscle. This masseter muscle here is cross-sectioned to clarify the medial trigoid muscle. We have also accessory muscle of mastication. They are helping this muscle of mastication during chewing process, but we don't go to the tafasil and detail of this muscle, their origin, insertion, function. It's not important for these lectures. We just talk about the primary muscle of mastications. So just for information, you must know that we have also accessory muscle of mastications, which is related to the hyoid bone. We have the hyoid bone, it's a U-shaped bone, and the group of muscle that upper to this hyoid bone is called suprahyoid, and the group of muscle that is below this hyoid bone is called infrahyoid muscle. For the suprahyoid is digastric, stylohyoid, mylohyoid, geniohyoid, while for infrahyoid is sternohyoid, thyrohyoid, and omohyoid. So first we started by the uh, some review point. So the muscle of mastications, they move the uh, they move the mandible during mastication and speak. We have masseter, temporalis, lateral trigoid, and medial trigoid muscles. They develop from the first pharyngeal arch and all supplied by the mandibular nerve. So all of them are developed from the same origin, which is the first pharyngeal arch. In the embryo, we have the pharyngeal pouch or pharyngeal arch. From each this pharyngeal arch, it gives rise some part of the body. So this muscle of mastications, they develop and originate from the first pharyngeal arch. For that reason, all of them are supplied by the same nerve, by the trigeminal nerve. Trigeminal nerve give three main branches: ophthalmic, maxillary, and mandible. The ophthalmic is pure sensory, the maxillary is pure sensory, while the mandibular is two parts. We have the sensory and motor. When we say motor, it means related to the movement of the muscle. So, which muscle are innervated by the mandibular division of trigeminal nerve? They are muscle of mastications. This is the pictures of the first one, the masseter muscle. The masseter muscle. This picture is important for the exam. You must know the position and the shape and the what is the name, identify the muscle. I pointed on the muscle and I put the question mark. You must write down the name of these muscles for that point. Okay, it's the masseter muscles. So the masseter muscles, it's a flat quadrangular muscle, partly tendinous and partly fleshy. It overlies the lateral surface of the mandibular ramus. As you know, the mandible is divided into the body of the mandible and ramus of the mandible and angle of the mandible. Yes, we have the ramus of the mandible, the perpendicular part. It's called the ramus of the mandible. The horizontal part is called the body of the mandible. So this vertical part, the ramus part, have two surface, either inner surface and outer surface. Okay, so this masseter muscle attached to the outer surface of the ramus of the mandible. When you clenching your teeth, you can feel it and palpate the positions and the point of the masseter muscles. So the masseter muscle is quadrilateral in shape, covers lateral surface or outer surface of the ramus of the mandible, has three layers: superficial layer, middle layer, and deep layer. This is the shape of the masseter muscle that you see in the pictures. So the masseter muscle function, it's elevation and protraction of the mandible. Elevation, it means leading to upward of the mandible, and protraction, it means leading to pushing the mandible in front. Okay, the elevation is done by the deep fiber, while the protraction done by the superficial fiber. The nerve supply is the anterior division of the mandibular nerve by the masseter nerve, same as the nape of the muscles. So the nerve supply is by the mandibular nerve. The blood supply is by transverse facial artery. Here we have the masseter muscle. This is the masseter muscle. This one is the colored part is the masseter muscle, that if you notice the duct, the Stinson duct of the parotid gland is passed over the masseter muscle and opening on the oral cavity opposite to the upper second molars, and also you can see the accessory parotid gland overlying the masseter muscles. This is the masseter muscles, another picture. If you notice, it attached to the outside or the lateral surface of the mandible. So as I say, we have the superficial part and deep part. The superficial part have the origin and insertions. So the origin is maxillary process of zygomatic bone and anterior two-thirds of the zygomatic process of maxilla. The insertion is the angle of the mandible and posterior part of the ramus. The deep part origin is medial aspect of the zygomatic arch, insertion central and upper part of the ramus as high as the coronoid process. So if you notice that the superficial part and deep part, both of them, these two parts are inserted to the part of the mandible. Action or the function, because they inserted to the mandible, so the function is related to the movement of the mandible. So about the action, elevate the jaw with the superficial fiber causing protraction. About the temporalis muscles, the temporalis muscle, it's a large fan-shaped muscle at the side of the head. All the muscle of mastication, they are paired, so we have in both sides of the skull, in the right side and on the left side. We have the right temporalis muscle and we have the left temporalis muscles. For all of the muscle of mastication is the same. We have in the right side and in the left side. The temporalis muscle, it's a large fan-shaped muscle at the side of the head. You can also palpate and you can feel the temporalis muscle when you put your hand on the temporal region of the skull, on the side of the head. It's a fan-shaped, feels temporal fossa. Origin is temporal fossa and fascia covering temporalis muscle. Insertion is margin and deep surface of the coronoid process and anterior border of the ramus of the mandible. The ramus of the mandible, as you know, if you remember, it characterized superiorly by having two processes, the condylar process and coronoid process. So this temporalis muscle is attached to the coronoid process and also the anterior border of the ramus of the mandible. The temporalis muscle has two heads, deep head, anterior, middle, and posterior fiber, and superficial head, which is very small head, it's much smaller than the deep head. The nerve supply for the temporalis muscle is the temporal branch from the anterior division of the mandibular nerve. So the nerve supply of masseter muscle is by masseteric nerve from the anterior division of the mandible. For the temporalis muscle, it's innervated by the temporal branch of the anterior division of the mandibular nerve. The action or function is elevate the mandible. The posterior fiber retract the protruded mandible. Protruded mandible, it means the mandible that pushing in front and it lead to come back to its normal position. Retract, it means go back. Okay. So if I pointed in the exam, I put the question mark on this red muscle, this big fan-shaped muscle, and I say write the name of this uh, point. You must write down its temporalis muscles. This is another shape, another picture to show the temporalis.
الأعزاء في كل الصيدلة بلا زحمة من خصم أي مادة عملي أو نظري أرجو من الفورم اللي بعثناه على الجروب.
Sorry. And this is another picture of the temporalis muscle. So the function is elevate by the anterior fiber and protraction by the posterior fiber. The nerve supply is the anterior division of the mandibular nerve by the temporal nerve. Temporal nerve are supply the temporal nerve or supply the temporalis muscle, which is the anterior division of the mandibular nerve. The mandibular nerve is branch of the trigeminal nerve. Keep in your mind forever that the trigeminal nerve has three main branch: maxilla, ophthalmic, and mandible. And also keep in your mind that the ophthalmic is pure sensory, the maxilla is pure sensory, while mandible is both mixed sensory and motor. When you heard about that this nerve is motor supply, it means related to the function of the muscle. Okay. So now we reach to the medial trigoid muscle. It's quadrilateral in shape, has two heads, superficial head and deep head. Just 1 minute, okay, student? I don't have a charge. Just few minutes. Okay, sorry for that. So we have the medial trigoid muscle. It's quadrilateral in shape, has two heads, superficial head and deep head. The origin is superficial head from the tuberosity of maxilla, while the origin of the deep head is the medial surface of the lateral trigoid plate. If you remember, the sphenoid bone have two processes. We have the medial trigoid plate, we have the lateral trigoid plate. The sphenoid bone have two uh, 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 process, the lateral trigoid plate and medial trigoid plate. The lateral trigoid plate has two surfaces, either external and internal, or lateral and medial. This lateral trigoid plate is the site for the origin and attachment of the muscle of mastication, the medial and lateral trigoid muscle. The medial trigoid muscle attached to the medial side of this plate of this lateral trigoid plate, and from the outside it's the side for attachment of the lateral trigoid plate, lateral trigoid muscle. So the medial or internal trigoid muscle, why we say internal, because it's attached to the internal or inner surface of the lateral trigoid plate. It is almost a mirror-like image of the masseter muscle. It is rhomboidal and runs particularly in the same direction on the inner surface of the mandible. So it's exactly opposite to the masseter muscle. So I say again that the ramus of the mandible um, pretend that we have, keep in your mind, and we have the ramus of the mandible. We have the lateral surface or outer surface of the mandible, ramus of the mandible, and also inner surface of the ramus of the mandible. From the outside, it's a side and it's a site for the attachment of the masseter muscle, while in the inside of the mandible, of the ramus of the mandible, it's the site to attach the medial trigoid muscle. So we have the masseter muscle, we have the ramus of the mandible, and we have the medial trigoid muscle. So we have three layers. From the outside to inside, first we have the masseter, we have the ramus of the mandible, and we have the medial trigoid muscle. So the medial trigoid muscle is opposite to the masseter muscle. So in another word, from outside, in the center we have the ramus of the mandible. From outside we have the masseter muscle, while from the inside we have the medial trigoid muscle. So it is almost a mirror-like image of the masseter muscle. It means it's opposite to the masseter muscle. The shape is rhomboidal and runs particularly in the same direction on the inner surface of the mandible. It's very important for you that you know that the medial trigoid muscle is on the inner surface of the ramus of the mandible. So it has two heads, superficial head. Its origin is maxillary tuberosity and neighboring part of the palatine bone. Here it's important insertion, the medial surface of the angle and the ramus below the mandibular foramen. So origin is the medial surface of the lateral trigoid plate. What is the lateral trigoid plate? It's the projection, it's a process of the sphenoid bone. We have the sphenoid bone. This sphenoid bone in each side have the two processes, the lateral trigoid plate and medial trigoid plate. This lateral trigoid plate is the site for the attachment to muscle of mastication, medial trigoid muscle and lateral trigoid muscle. From the inside is attached for medial trigoid muscle, and the outside or lateral surface of the lateral trigoid plate we have the lateral trigoid muscle, the same name, okay? The posterior surface of the tubercle of the palatine bone and tuberosity of maxilla. Insertion in the trigoid tuberosity. The trigoid tuberosity is the landmark on the inner surface of the ramus of the mandible. So the side of the insertions is the mandible, inner surface of the mandible. On the inner surface of the mandible, of the ramus of the mandible, we have some projection, some landmark called trigoid tuberosity. So keep in your mind that this trigoid tuberosity is part of the ramus of mandible. Okay? Action, because it's attached to the ramus of the mandible, it's attached to the mandible, so its function and action is also related to the movement of the mandible. So it's elevate or pushing the mandible upward and protract the mandible. Protract, it means in front, pushing in front the mandible. It also moving the jaw from side to side when acting singly. Also, if you notice, if you're chewing a gum or if you're chewing the food, one of the action of the mandible is elevation, downward, and side by side. Side by side we have upward of the mandible, we have downward of the mandible. This is called chewing, okay? This side by side movement it's done by the trigoid muscle, both of them, medial and lateral trigoid muscle. So if you notice, this picture is very important. This is the medial trigoid muscle. Okay, this is the medial trigoid muscle also. If you notice, this picture is taken from the inside of the mandible. Inside, not outside. From the outside, we have the masseter muscle, exactly on the opposite to the masseter muscle. We have the medial trigoid muscle in the same direction. Exactly, they are as a mirror to each other. This picture also very important. Look. It shows the medial trigoid muscle, both deep head and superficial head, and also it shows the lateral trigoid muscle, upper head and lower head. The lateral trigoid muscle or external, why we call it external? Because it's attached to the lateral surface of the lateral trigoid plate. It's a thick and triangular muscle with two heads, upper head and lower head, It is the muscle of mastication that occupy primarily a horizontal positions. If you notice, look at these pictures. This muscle it position is in a horizontal positions. So origin, superior portion, infratemporal surface of the greater wing of the sphenoid. Inferior portion, it means upper head and lower head. Lower head is lateral surface, look, lateral surface of the lateral trigoid plate. It's important to and keep in your mind. Insertion fibers are redirected laterally and backward into the front of the trigoid plate. Trigoid plate. It's also the landmark. If you notice in the picture, the trigoid plate is also the landmark on the mandible. Action, depress, it means leading to depressing the jaw, leading to downward of the mandible, protruded and move the mandible from side to side. So from side to side movement is done by the medial and lateral trigoid muscles. This is the medial trigoid, this is temporalis, and this is the masseter muscle. Masseter, medial trigoid from inside, masseter is outside the ramus of the mandible in the center between two muscles. These two muscles are exactly on opposite to each other, like a mirror, and in the same directions. And this big fan muscle is temporalis muscle. This is the lateral trigoid muscle, the upper head, lower head, and another one is the medial trigoid muscle. In this picture, it's clearly we can see the position of the temporalis muscle, this big fan shaped, and another one is the masseter muscle. Okay. This is for a review point. The innervation of masticatory muscle, innervation of all masticatory muscles, is supplied by the mandibular division of trigeminal nerve. And do you have any questions?